question was brought up about whether colonics are helpful. Those are enemas, regular enemas and high enemas. In the medical field, we do use colonics or enemas to clear or prep a bowel, an abdomen for either a CT scan to diagnose to look at the inside of the belly with contrast through a CT or a plain X-ray. Or before undergoing surgery, you have to have everything cleaned out, and it's helpful. I've had several patients use colonics. I mentioned this in one of my lectures. I had the drummer for a very famous rock band come in, and he was having problems with abdominal pain, and I couldn't figure it out. Eventually, we had a CT scan of the abdomen. This is after going through a whole bunch of possibilities for rib fracture, muscle strain, and the like. So the thing is, after he had before he had the CT scan, he had to have an enema. And he told me that when he had the enema, all of his abdominal pain went away. So he still had it anyway, and I didn't find anything. So bottom line is that with the way the bowel is mistreated in American society with American food, and with the stress that usually is experienced in eating, I don't think that the colon and the gastrointestinal tract altogether are allowed to do the job that they want to do. So the result is constipation. So constipation, we usually need some help, especially if you have constipation dominant irritable bowel syndrome. You want to get relief. Colonics are a temporary measure, but they are dangerous because the bowel can get very used to having a colonic and actually get weaker it'll be dependent on the colonic. Kind of like a child. One of the tricks with a constipated child is to take a rectal temperature, and sometimes the rectal stimulation will stimulate a bowel movement. But very dangerous if a parent keeps on doing that. It'll cause fissures, it'll cause a whole bunch of other problems, but not recommended. Same thing with adults. If you keep on doing colonics, they can be unhealthy. It can cause a malabsorption. You can force the contents of the colon out before things are ready. The colon does have more functions than just storage. It's also important for reabsorption of fluid and reabsorption of certain vitamins. So vitamins and minerals. So if you change around the dynamics of function and make using colonics or enemas, it can be a problem in the long run. The Gerson Institute in Mexico uses colonics for coffee enemas in particular for therapeutic measures. Glutathione is an antioxidant that's created in the liver when given a coffee enema, and there's a certain protocol that the Gerson Institute uses, and supposedly their cancer rates and success rates for chronic disease are great. I don't know the stats on that, but they commonly use coffee enemas in their protocols. So bottom line is that they are useful in medical situations. The bowel can become very dependent on them, so I would not use it on a regular basis. Patients state that they're very relieved symptomatically when they have colonics, but in my opinion, I do believe that somebody with proper sleep, proper hydration, a mostly plant-based diet, in addition to relaxation therapy, and should be able to have proper bowel movements on a regular basis. I think a daily bowel movement is a very important thing. I think society has been very used to having one bowel movement a week, and I don't think that's healthy. Even if you're not feeling any symptoms, I still don't think that's healthy. So best to talk to your doc, find out about doing things, and definitely investigate why, if you are those folks who needs to use colonics all the time, investigate what's going on and why the bowel needs it. Hopefully this helps.